1 in 6 couples suffer from infertility issues. About half of those cases are due to male infertility. Well, let's welcome back Dr. Heather Cook, Reproductive Endocrinologist at Coastal Fertility Specialists. It's great to have you back.
Thank you so much for having me.
That number, it's always surprising that men account for almost half.
Right. Right, so we always just assume, especially as GYN doctors, that this is a female issue, but it's really not. The amount of male infertility that we see is really underappreciated. And so generally we think of a couple coming in with infertility, about a third of that is going to be just female, about a third just male, and then the other third kind of a combination of multiple factors.
Fascinating. What do you think accounts for male infertility typically?
So there's a lot of different reasons. You know, obviously guys are not checking sperm counts unless they're trying to get pregnant. Sure. So a lot of this is just lower sperm counts or low motility that we may need to do other workup to see what the cause of that is. And so a lot of times it's unknown when they come in.
Oh, I see. And is this ever due to genetics? Is it hereditary?
It can be. So there are certain things that can be passed in families, and those are usually seen with very low or no sperm present.
Yeah.
And so if we identify that a man has no sperm, that's when we would recommend, let's do some genetic testing, let's do some hormone testing to try and figure out why this is happening.
What is the term male factor infertility? What does that mean?
So that really just means any cause of infertility in a couple that is derived from a sperm issue. So anything from the male side of things.
I see. Okay. And talking about supplementation like testosterone and things like that, that tends to interfere with fertility.
It does. So we see this a lot. You know, men who are coming in and they're taking testosterone. There's a lot of different ways testosterone is prescribed. It can be injections, it can be a gel, a cream. There's a lot of ways that men take it, but they're taking it because maybe their doctor outside had diagnosed them with low testosterone levels, or they just go on it to feel better. What people don't realize is that actually will shut off sperm production. So it kind of has the opposite effect that people are going for. And if we evaluate a man who's been on testosterone for a while, we will check the sperm count and it'll essentially be 0.
Wow, really?
Right. Yep, it shuts it off.
So if you were to stop taking testosterone supplementation, does it snap right back?
It does come back, but it takes about 3 to 4 months, sometimes a little bit longer if a man's been on it for a long period of time. And so that's something that people don't realize either, is that the sperm cycle itself is about 3 months. So any intervention that we do, whether that's adding medicine or stopping medicine, it takes about 3 or 4 months until we're going to get an accurate idea of what the true count is.
Do you think testosterone is being prescribed a little too willy-nilly? Is it
you know, I think we're seeing that. We're seeing it more often with, you know, different men's clinics and things out there, which there are a lot of men that probably do need testosterone to, you know, increase their levels or feel better. But the problem is when a couple is trying to get pregnant, we actually need to use different medications to help them than testosterone. So there are medications that can treat symptoms that are also compatible with getting pregnant.
What are the other things that get in the way of fertility for men?
So we generally counsel men on lifestyle issues, you know, heavy smoking, marijuana use. We know all those things can really cause low sperm counts, motility with the sperm where it's just kind of sluggish and not moving well. And we need moving, healthy, good amount of sperm to be able to get a pregnancy.
So lifestyle, so you mentioned smoking, drinking as well, I would imagine.
Drinking not as much as the smoking and marijuana, you know, general kind of health as far as keeping a normal weight, not being overweight, just general lifestyle health things.
And what would your advice be to a couple that comes to see you and they're just having that problem, they so desperately want to have children?
Right. So we generally recommend a full workup at the initial visit, because when they're coming to see us, again, we don't know, is this a female factor, is this a male factor, is this a combination of both? And so we generally will have a couple do all of their testing so that we know what we're working with. We'll have the male tested from the sperm standpoint and then also test the female so we can give accurate ideas of what treatment's going to be needed.
Fantastic. Very holistic approach. I want to thank you so much, Dr. Heather Cook, for joining us.
Thank you so much for having me.
We're back after this.